From Alexiou Hearing and Sinus Center, we have with us Dr. Michael Alexiou, ear, nose, and throat doctor and head and neck surgeon, and Dr. Kristen Sewall, audiologist and licensed hearing instrument specialist. Thank you for joining us. So tell me, Dr. Sewall, what are the symptoms that people, and particularly maybe family members, should really start to pay attention to when there might be hearing impairment?
Often people with hearing loss will ask everyone to repeat what they've said. You hear a lot of what or huh coming from them. And very often they'll feel like people are mumbling. They'll feel like most people, when they have hearing loss, it's not all or nothing. They'll hear some sounds but maybe not others. So they'll hear speech, they'll hear people talking, but they may not always understand what they're saying. So the symptoms are typically to ask people to repeat what they've said.
And Dr. Alexiou, tell us why people should in particular choose your clinic for diagnosis.
Well, there are literally hundreds of types of different hearing losses, and we categorize them into two broad categories, neural loss and conductive loss. And the importance in understanding how you can help someone is knowing exactly what type of loss they have. I think that's one of the strongest part of our practices, is that the diagnosis is going to come out correct with us working together as a team, and then at that point we can move forward with accurate treatment.
One of the things recently, just last week, a friend of mine was telling me about her father just getting a hearing device. And she said she was really happy with the result because he had re-engaged with the family and really it had been life-altering. But she was really sad because how long had he missed out on doing that? Why do you think that people are in avoidance over getting a diagnosis and getting a hearing aid?
It seems like a combination of reasons, from whether they're concerned about what it might look like, if they feel it's going to make them look older to wear a hearing aid. And in addition, I think, unfortunately, there's hearing aids, the longer term history on them is that initially what came out maybe didn't sound as good. So a lot of people are afraid what they're going to get will not sound good to them. But the technology's come a long way, and now I think we're able to fit several more patients with hearing loss and make them happy in different environments. If there's background noise, they now can wear the hearing aid in a noisy place, where before the hearing aids would turn up everything, and that would be frustrating. So I think that if they knew someone that had hearing aids, they might have heard things about them that were negative.
So now you are able to replicate very close to a natural return to full hearing.
I would say I think our technology's come far enough to be able to reduce things like background noise or enhance speech in the presence of background noise, and I think that's a huge step forward in the technology that we have.
One of the things that, I can't imagine that it could be a reason or an excuse for cosmetic reasons for anybody, or an age stigma or anything else, of why would you kind of disengage with society over a device that's that tiny?
Sure.
I mean, are they all that tiny?
They can be. And in fact, now the technology is far enough that you can have a device this small and even have significant hearing loss, that we're able to work with that now.
Wow, that's amazing. Tell us about some of the other things that you brought with us and how that kind of plays into a treatment for your patients.
Well, what's nice about, because when you go to smaller hearing aids, you're going to be requiring a smaller battery. And for patients who are older who might have difficulty with arthritis or dexterity, they might want the smaller hearing aid but then have difficulty working with the batteries. And now there's options available to have a hearing aid that's rechargeable. So at night they can take their hearing aid out, just simply put it into a case, snap it shut, and the next morning the hearing aid is going to be ready to go. That they don't have to worry about taking a battery out and throwing it away and changing the battery. So this kind of makes the smaller technology more available to everybody and not limited to just those who can work with it.
And what about, this seems to have kind of an up and down, a plus and minus. Can you literally change with just something you carry in your pocket?
Sure.
That's pretty amazing.
Today you can have pretty much the accessories are what are popular with hearing aids right now. So you can have a remote control if you want it to make adjustments to turn the hearing aids up or down. In addition, this is actually a phone clip, which is an item that you would wear. And when a phone call comes in, you would go ahead and press the button on the device, and it would pick up your phone call directly in the hearing aids to cut down on background noise.
Wow. So you guys our technology has essentially thought of everything. I think what you pointed out earlier is that you are a full medical clinic, ear, nose, and throat surgery of the I guess, up to here.
Yeah.
And so that gives patients options in terms of a full realm of treatments based on their needs.
Mm-hmm.
And that's the word that I think it's important, is that patients get all of their options, because hearing aids aren't always the best option for someone. They really, hearing aids have come a long way and are great for patients that have sensory neural loss or neural type losses, and we can do so much with those patients now. But we want to let patients know that there are medicines and sometimes surgeries that can help them hear better as well.
Very good. Thank you so much for joining us. You can find more information about any of our topics at the Health First section of WHSV.com. Please stay with us.